According to most surveys, teenage smoking, alcohol consumption, and marijuana use is down, which is the good news. But the bad news is...
Yeah, even though there's enormous progress on the drug issue, the bad news is that prescription drug abuse, over-the-counter drug abuse, and also inhalants are all going up.
Why is that?
Well, really what we're hearing from kids is these are household products. These are things they're getting from mom's medicine cabinet or friend's medicine cabinet, and they believe very truly that it's a safer way to get high, which is a real falsehood.
Why? How can you dissuade them of that notion right here?
Well, clearly, when you abuse prescription drugs in the same way that you would have used illegal street drugs, they are every bit as dangerous and every bit as deadly as the street drugs.
And every bit as addictive.
Every bit as addictive given what the drug is, particularly prescription painkillers.
Tell me about some of the numbers because they're really frightening.
Right now in America, we've got about 1 in 5 teenagers who is admitted to abusing prescription drugs and about 1 in 10 who have admitted to abusing over-the-counter cough medicine. Those numbers are higher than cocaine or heroin or a lot of the things that are on most parents' radar screens. This really represents a whole new tier of substance abuse in America and something that most parents don't have any experience in because it didn't happen when they were teens.
Is this an urban issue, suburban, middle class, lower class, upper class, what?
The clear thing that everybody needs to understand is prescription and over-the-counter drug abuse cuts across all lines, socioeconomic, race, region. It's happening everywhere in America, and you can have a great kid who's a wonderful student and an athlete, and he or she can still make a mistake, make a bad decision, and try these products and get themselves caught up in a cycle that leads to other substance abuse.
What is the prescription drug of choice these days?
Well, it really runs the gamut. Some kids are abusing pain medications, very specifically to get high and that dizzy, fuzzy feeling, where others are using them very tactically. Adderall, Ritalin, things that are attention deficit drugs for school study aids. In college you see it, in high school you see it. So there's a mix of getting high and, if you will, using it for the intended purpose of the medicine, but well outside of a doctor's prescription. Frequently we see these drugs abused with alcohol in the get high scenario. And what we need to understand is while these are safe when prescribed by a doctor who knows you and knows your medical condition, they can be very dangerous when friends are trading them among themselves.
Parents are not discussing this with their children, are they?
No, most people would be stunned to know that only about 50% of parents even have in-depth conversation with their kids about drug abuse in general. When you bring it down to prescription drug abuse, it drops to a third. We know that kids who learn a lot about the drug issue at home are half as likely to abuse drugs as kids who don't. So parents have enormous power to weigh in on these issues, communicate to their kids that it's not safe and it's not acceptable. And when you do that, it has an enormous effect in their not using.
What are the warning signs for parents? What should they be looking for?
We know they're the classic substance abuse warning signs: change in behavior, change in health, change in complexion, change in networks of friends.
Secretive.
They're not the demonstrative bloody red shot eyes, munchies kind of things that most parents would look for, the smell of alcohol. What you need to really do is be in tune with your kid's life, who they are, who their friends are, who their friends' parents are, and understand what's going on in their social context. But regardless if you think your kid is using or you're convinced yourself my kid will never try, you still need to weigh in on this.